A line-by-line review of Ontario expenditures to find efficiencies, as promised by progressive Conservative Doug Ford, would undoubtedly find savings. But if he wants to start his review with a bang, here's an idea: abolish the awkwardly named LHINs. You could easily be forgiven for not knowing what LHIN is. It stands for Local Health Integration Networks. They are 14 independent behemoth bureaucracies created by the Liberals in 2004, complete with 14 CEOs each making about $300,000 a year with their own boards, and each loaded with bureaucrats. They operate mostly in the shadows. And they gobble up $100 million a year of our healthcare money. That's not chump change. They were ostensibly created by the Liberals to distribute the billions spent by the Ministry of Health and Long-Term Care and coordinate services provided by hospitals, long-term care homes, community, mental health and other care providers. They were touted as heralding a new era in community health care. It was all about making healthcare decisions locally and making them accountable. When I was Ontario's ombudsman, I investigated the Hamilton Niagara Haldimand Brant LHIN in a report called the LHIN Spin, and what a spin I found. LHINs, by law, are supposed to hold public meetings to get community input on local health decisions, subject to very limited exceptions. Instead of holding mandated public meetings, the LHIN I was investigating was having clandestine, secret meetings under the exception of education. The education exception was meant to cover things such as IT training and such. It would be nonsensical to force an organization to hold these sessions in a public meeting. In essence, they were abdicating their role of conducting public consultation. This LHIN was an elitist little bunch. Rather than consulting and making tough decisions on where funding should go, what they were effectively doing was insulating the Liberals from accountability. The Liberals simply washed their hands of any controversy by deflecting it to the LHINs. One board member told me that sure, he consulted with his pals at the local golf club, in shopping centers and in line for groceries in creating a dedicated children's hospital. So, if you couldn't afford a membership at his golf club, you were out of luck unless you stocked the local shops and happened to bump into him. This LHIN even had the nerve to try to justify their conduct until the health ministry told them to smarten up. I say kill the LHINs, return $100 million to frontline staff, like doctors and nurses, and return accountability where it belongs, to Queen's Park. Dirk Gill, president of Concerned Ontario Doctors, pulls no punches when it comes to LHINs. She emailed me, WIN's government has rewarded the LHINs' incompetence by creating more vast layers of bureaucracy, nearly 100 new regional sub-LHINs. Ontario Liberal leader Kathleen Wynne stands on the podium as Provincial Finance Minister Charles Sousa makes a policy announcement at the Finishing Trades Institute of Ontario in Toronto, on May 14, 2018. The Canadian press: it is appalling that for a healthcare system in crisis, there are more bureaucrats than family doctors on deck. No bureaucrat has ever saved a human life, but this bureaucratic bloat has certainly helped the government ration patient care and avoid accountability. So, it appears that the inefficient LHINs have multiplied just like tribbles in Star Trek movies. What a terrific opportunity to find efficiencies. She pleads, much like Ford, that frontline caregivers should be consulted on replacing the LHIN model. It is time for Ontario to abolish the LHINs strangling our healthcare system and finally reform our broken system by working with those who have an intimate knowledge of our crisis and are able to provide tangible solutions. Our province's frontline physicians. We should also look at other provinces with regional models that directly govern or provide health services. The current model was doomed to fail from the get-go. As it stands, the LHINs are currently just another Liberal boondoggle.